Good afternoon, everyone, and welcome to our first webinar for 2026. Today, we're kicking it off with managing feedback, consumer expectations, and transparency, which is going to be a great topic. And for many of you, also may have seen the commissions earlier in the week on a similar concept and topics as well, which is again very relevant for the industry right now. We've got some great presenters who will start to talk us through this. But first off, we would also like to acknowledge the traditional custodians of the country throughout Australia and their connections to land, sea, and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today joining us. So, what is our agenda look like today? Well, as always, we will kick it off with some data insights from Tyler, our data scientists. We'll then dive into our early poll results and the questions that we asked while everyone was registering. Then we've got a fantastic presentation from Steve from Proactive Complaints Management, who works day to day dealing with aged care homes and helping them through the process of how they deal with this and how they deal with families and mediation and so on. So he's got some great slides to take us through and some topics to cover. Then we'll dive into a very quick live poll just to gauge everyone's thoughts right now on a key topic that's reflective in our session today. And then we'll be going on to our panelists. So we've got two great panelists today from homes across Australia as well to talk more about how they are managing this topic within their aged care organisations. And as always, there will be Q&A. So please ask any questions you have in the chat. And hopefully, time permitting, we will dive into those towards the end of the session. And you can ask those direct questions of either Steve or our panelists joining us today. Also, please remember this event does qualify you for one CBD point. Add that to your log. So if you are in that program, you can use this webinar today. And as highlighted already, please ask questions. We like this to be interactive. We'd like to hear what your thoughts are. Ask direct questions, or if you've got some comments to make about how you're managing the complaints and feedback management within your organizations as well. So first up, we are going to hand off to Tyler, and he's going to take us through some of the data that he's come across as part of our topic today. Tyler.
Thanks, Ben. As we'll discuss, providers are responsible for managing feedback and complaints about their own services. We should empower people receiving care to speak up, offer feedback, and raise concerns if something doesn't seem right. To enable this, providers need to understand their obligations to effectively manage feedback and complaints. Being open to feedback and providing an accessible forum that adequately addresses concerns and allows people to feel heard can avoid complaints being escalated to the Quality and Safety Commission. And that's where we get this data from. So we're looking at what the Commission has published in what they've received. And when we look at the total number of complaints, it can be a little misleading in some ways. And so it can help to benchmark using the rate of complaints per 10,000 occupied bed days. So you can see here nationally that average is 0.8. So 0.8 complaints per 10,000 occupied bed days. And we can use this rate to compare the number of complaints between services while also keeping in mind the different size of each service. And so if your rate is higher, and obviously I would suggest that all homes sort of calculate this on their own. And if you do come up with a rate that's higher than that, it's really important to understand why. And is it that are issues raised multiple times and remain unresolved? Are there any problems with your feedback cycle? And one of the carry-ons from that sort of having an accessible feedback cycle is looking at who is making complaints. And you can see on the pie chart below, or the donut, a big majority come from family members. And the next largest source being people who want to remain anonymous. And I think allowing people to provide feedback and remain anonymous, that's an important mechanism to allow for. But with such a large majority of complaints going to the Commission originating from family members suggests that broader communication to external representatives may be required. And that's a good segue to the next slide, which looks at the types of issues being raised. So the most common issues are relatively consistent over time. Complaints about how medication is administered and managed is the number one issue raised with the commission about residential care. The next most complained about issue, the two next most complained issues are concerns about hygiene and the number of staff. However, with the steadily rising delivery of care minutes across the sector, we predict that complaints about number of staff will decrease. And just going back to that source of complaints, if you were to combine the categories of family consultation and lack of consultation slash communication, this would be by far the most common complaint. And just to quantify that a bit further, so medication management makes up 15% of the top 10 that we're looking at here. But the consultation plus communication categories makes up nearly 20%. And so I think it's interesting that they sort of split those out where, again, I think when you look at overlay the source of most complaints coming from family members, and then looking at that issue around communication combined with consultation, I think that really paints a picture of where services that are getting complaints can focus. And then finally on the last slide, again looking at which services are attracting complaints and which are not. And we can see here a third of all homes had no complaints made to the commission in FY25. And so if your home falls into that group, then it's important for you to distinguish between probably three main categories. So one, residents and families are satisfied, which is great. And then the second would be residents and families have raised their concerns directly with the staff or the home, and they're satisfied with the way that was handled. So also they're well done. However, it is important to uncover and address the possibility of the third category, which is that the feedback process is broken or people are not confident to speak up. And I think that really is a good jumping off point for our panel discussion and our poll results, where I think handling complaints well means creating a progressive feedback cycle. Do people, meaning residents and families, feel confident to be able to provide feedback? Do they know how to do it within your organization? And so, Ben, why don't you now take us through the poll results and see what people are saying about their own homes?
Fantastic. Thanks, Tyler. And I think the key thing that I think to take away from that is that the communication, which again we'll probably unpack a little bit more as we talk to our panelists today, is so critical as part of managing your feedback processes. So as I said, let's dive into our initial poll results that we asked. So here we had 292 responses across 170 organisations. So our first question was, how confident are you that your current complaint system would meet regulatory scrutiny today? So we've got 67% are somewhat confident, so that's not bad. They're fairly confident. Very confident, 23%, which is great, that they've got those systems in place. And there were 5% not confident and 5% unsure. So I think we've probably hopefully got some of those people on joining us today, or we'll watch the recording, that can have some great things they can maybe take away of how they can sort of build on confidence within their strategy and their system. Our next question was, how easy is it for consumers and families to provide feedback or make a complaint at your service? And again, pretty split. 48% say very easy and it's well understood processes, which is great to see. 45% somewhat easy, but could be a little bit clearer, which takes up the majority. And then again, you've always got that smaller percentage. So 4% are not sure from a consumer perspective, and 3% feel that obviously it's still difficult or inconsistent for them to make a complaint at their service. So then what typically happens to complaints and feedback once they are received at your home? So obviously pretty strong, 54%, they're reviewed and addressed case by case. 35% though are used to drive measurable service improvement, which is great as well. 8% are logged mainly for compliance purposes. Hopefully they would take some action from those. And 3% not consistently analysed or reported. So obviously a few in those smaller numbers that are obviously ticking the boxes, but maybe not diving really deep into why these things are happening and occurring. And then we'll go into which areas do consumers most frequently request more transparency about in your facility. 29% day-to-day operations, so menus, activities, room availabilities, and so on. 21% on staffing levels and continuity of care. 16% on incidents and safety matters such as falls and medication errors. 15% on fees, pricing, and cost increases. 11% care decisions and quality performance data, and 8% on the complaint handling processes and outcomes. So again, some interesting numbers, and we will start to probably unpack a few of these and find some of those themes as we work our way through our panelists today. So first up today is Steve from Proactive Complaints Management. He's going to be taking us through his slides and doing a bit of a presentation on the things that he sees out in the industry as he goes and works with homes and educates their staff on the processes and the best practices, and also helps mediate with families. Nicola Burton, Executive Manager of Quality and Organisational Development from Peninsula Villages, will be joining to provide her perspective on how they're managing these processes within their home. And then also Jess McKenna, Quality and Compliance Manager from Bene Aged Care, will also be joining us to be able to hear her thoughts and a different perspective from her organisation and the processes and how they manage it. So first up though, Steve, I'm going to hand it across to you and we'll run through your presentation around managing the feedback, consumer expectations, and transparency in aged care. Steve.
Thank you, Ben. Hello, everyone. It's interesting what Tyler was saying a little bit earlier at the beginning in regards to communication, because one of the things that I say to providers is the most important thing in communication is hearing what isn't said and reading between the lines and understanding expectations and obligations of that we have towards our residents. It's also interesting when we're dealing with complaints because we spent an inordinate amount of time on surveys to get feedback of what people think about the services we're providing, but we have a nugget of information from complaints to actually look at our process and procedures and so forth. Ben, you want to put up the slides?
Yeah, can you see that, Steve? I got the introduction up. Do you want me to?
No.
No.
Well, while Ben is organising that, so what I'll specifically be looking at is feedback and complaints are no longer what we call quality activities. They are a governance, risk and safety control that regulators look at. Regulators are also assessing how systems operate in practice, not whether a policy exists. So a lot of organisations have policies, but do our practices reflect our policies? The strengthened aged care quality standards and statement of rights required accessible, transparent and responsive systems. But the real challenge is operational capability, and what we need to consider is that embedding that consistency, defensibility and learning through our complaints program. I'm going to focus on building practical evidence-based systems that withstand scrutiny from our regulators. We have a technical difficulty there.
I think just to check, is Tyler, can you see my screen?
Yeah, I can see it's coming through.
It should be, Steve. Maybe just the presenter view, you may not be able to see them, but I think everyone else should be able to see them, hopefully.
Okay. Cool. I'll continue then. So what regulators expect from an effective complaints feedback is they expect evidence, accessibility and safety is one key area, a visible, easy-to-use system. So how easy is it for staff, for consumers to understand, to use? Multiple complaint channels, not just through filling out a form, but verbal, written and anonymous complaints, which is interesting because one of the questions I get is about anonymous complaints. How do you handle those? well, you'd handle it the same way as you would any other complaint complainant that's named. How do you feedback from an anonymous complaint? If you have a newsletter, you may want to generalise it and without being specific and say what improvements you made. The anonymous individual will actually read that if they read your newsletter. Access to advocacy services, access to interpreters, and alternative formats is really, really important. The next part is escalation and risk controls. Define triage and harm categorisation is important. You need to have clear escalation pathways. So by that, I reference, if I'm not satisfied with the outcome, what options do I have? So that should be embedded in any letter that we send out through our program. You can go to the Commissioner's office, you can get your advocacy involved. You need to integrate your complaints program with your serious incidents response scheme. Work health, psychosocial risk controls are really, really important these days, because what I'm seeing throughout the industry is an escalation in the way complaints are raised by complainants, which cause some significant psychosocial impacts on staff who are managing it, being screamed at, sworn at, threatened. So that's really important to embed those within our program. Clinical governance and risk registers should be integrated within that program also. The next stage, of course, is our governance and board oversight of our complaints. So boards and executives must be able to explain, to explain what complaint themes are emerging. So what is the consistent themes that we're getting within the organisation? What risk signals have been identified? So risk signals are that put, risk of a complaint going into the social media realm, to the regulators. So we need to be prepared for that. What improvements have been implemented? So the board should be aware of that, and how outcomes have changed our programs and our processes. If a leader can't articulate this, regulators may assume systems are not embedded within the program and the organisation. But most dissatisfaction arises from what we call the misaligned expectations rather than adverse outcomes. And this goes back to what Tyler said, that communication, the expectations. There's two parts to expectations, of course. There's what people want and what people would like. Their wants are, but we need to identify that really quickly, and we need to advise our complainants, can we achieve that or not? So transparency requires at entry point, the service be clear about and explaining what services an organisation can and cannot provide. Rights and limitations, and I'm seeing a fair bit throughout the industry and throughout Australia in particular, where you have two residents in dispute. One may or may not have a cognitive impairment. The family get involved, and the family become really hostile and say to the provider, you must move that person to another room. Get them out of this area. Now, there are rights and there are limitations. You have a right to quiet enjoyment of your space, but the limitations are you can't actually move another resident from their environment. And the other part is how to raise concerns and complaints within the organisation. When we receive that complaint, one of the basic tasks that we have to undertake is we need to confirm what the issue is. So offering the opportunity and allowing the complainant to use their own language to describe the complaint. And what we do in the mediation realm, we reframe what we've heard. So we say, so let me see if I've heard you correctly, what you're saying, and we summarise this A, B, C. So what is the issue? We also ask, what would be the best outcome for you? What would be the desired outcome? What would you like to see happen? We then can actually pull that apart and say, is it the organisation's responsibility, or not? We confirm also during a complaint the investigation scope. So what are we looking? So if someone says to us, I want that staff member sacked, we have to be really clear and say what happens within that realm is the organisation will treat that in a way that it respects the privacy of the individual staff member, but that may not be achieved. It may involve retraining that staff member, but we won't tell you the actions we take against that staff member. The timeframe's also really important. So best practice, according to the International Standards for Complaints Handling, the ISO 10018 is you need to respond to a complaint or acknowledge a complaint within 24 to 48 business hours. And acknowledging complaint is basically saying, thank you, I've received it. We will now look into it. I will organise a meeting with you. Invariably, that's what happens when complaints are escalated. They don't get that acknowledgement for a week or 2 weeks later, excuse me, that someone's received that complaint. So timeframes are really important. During your investigation process, another thing that we've noticed actually escalates complaints is keeping the complainant updated about where you're at. You don't want silence for weeks on end. I would be suggesting that providers should at least give, if it's going to be a longer complaint than expected, you should be at least providing updates weekly to the complainant about what you've done and what you're still looking at. You need to explain the limitations really early about what you can and can't achieve, and also outline your potential outcomes realistically. When we move through that investigation process, the intake, the investigation, and the closure, if you either a written or verbal response, it should include what issues you considered, so the facts that you looked at, what your findings are, what your rationale is for the decision, being really factual. You should describe or explain to the complainant any improvement actions you've taken as part of your continuous quality improvement. It could be staff training, it could be a policy change, it could be staffing timing. You may have introduced, for example, an extra 2-hour shift during morning peak periods, and review your escalation options that you should be explaining to your complainant if they're not satisfied with the outcome. Or you may want to review the findings if the complainant comes back with new information that you did not consider in your original complaint. So if or when an outcome is not substantiated, that is, you've investigated it, it's not as was thought, transparency about the process and the reasoning reduces escalation risk. So clarity will reduce this risk. Regulatory involvement, clarity will repeat the complaints. Staff distress, which is a huge issue at the moment, and if we get an opportunity, I'll talk about that later. And defensive culture. I know that didn't happen here. I mean, as I said earlier, we spend an inordinate amount of time on surveys, but complaints give you little nuggets of gold and intelligence about what people are thinking about your service and your service delivery. Complaints are what we call organisational intelligence. I know we get stressed when we receive complaints, but complaints are a window to our soul. They tell us what we are doing right, what we can improve on, and what people are thinking about us, which is something that as organisations we all want to know. It goes beyond what we call case resolution, and providers, according to regulators also, must demonstrate patterns and trend analysis, and they should be done monthly or quarterly with a theme review. So what are people or consumers and families, what are the issues they're raising? If we have multiple sites, cross-site comparisons, because we're dealing with a number of providers now which have in metropolitan Sydney, but we also have people that have organisations or facilities in rural areas. The cross-site comparisons are significantly different. We have to identify repeat issues. So why are we getting the same issues repeated on an ongoing basis? And for myself, the most important tool in our arsenal is that root cause analysis, those 5 whys. Why did it happen? Why? And really digging down into the trenches and trying to figure out what's going on. The learning loops that come out of that, evidence of policy amendments. So has a complaint resulted in a policy amendment? Has the complaint changed our practices, how we do things? Targeted staff training. And I think as a byproduct, I should just add, every single staff member, from kitchen hands to PCAs, need to at least understand what a complaint, what's defined as feedback in a complaint, and how and when to refer it, or what they can and can't do to manage a complaint. Even a 5-minute toolbox at handover should be discussed. Environmental adjustments we could make as a result of a complaint, and communicate improvements either through your newsletters and through resident committees are of extreme importance. Now, the one thing, of course, that we all are aware of, and it's said multiple times in regards to documentations, if it's not documented, it didn't happen. You need to maintain an actions register, improvement tracking logs, completion dates, and that completion date should also include the last communication you have with the complainant, and impact review outcomes. And that's really important for us as an organisation to understand where we're heading and to ensure we've actually closed off a complaint. So what regulators will look for, and I will add here that the Aged Quality Commissioner's Office is not out to crucify anyone. The Aged Quality Commissioner's Office will work collaboratively with providers to ensure that they're meeting the needs of their consumers. So sometimes it may be worthwhile to reach out to them and seek their advice. They don't always provide you with advice or suggestions, but you can play around with discussions with them. So the regulators will look for not just closure letters, but documented continuous improvement cycles and logs to make sure that you've followed up and what you've actioned actually reflects a complaint. The goal is not fewer complaints, it's a safer system. I recently had a conversation with a number of providers, and they said to me, one said, I get 200 complaints a month. They're a very large organisation. Other providers in the room balked at that, and one said, I get 3 or 4 a month. Now, there's neither a right answer or wrong answer. The 200 a month, people clearly know how to complain. What do you do with that information is a question. The other side of it, 5 or 6 or 7 a month is, okay, do people understand how to complain? Or do you resolve those issues that arise there and then on the spot? But do you document that you've taken action? So that evidence is really important. The common gaps that we found with providers is over-reliance on policy. Policy exists, but staff lack the capability of managing them. Some suggested solutions, excuse me, are structured training programs, scenario-based learning, standardized response frameworks. That scenario-based learning I found to be really important, because if you have an escalated complaint, sitting down with staff and really picking it apart and actions and continuous improvement really helps galvanise the thought process. Inconsistent response across sites. So decision-making and documentation could be a potential problem. Investigation templates should be a go-to for all providers. Triage matrices should also be included. Manage a checklist to make sure you've acknowledged on time, responded appropriately, you keep people informed. Central oversight of high-risk complaints. So who's responsible for those high-risk complaints that could escalate externally? The third gap is complaints treated as isolated incidents, okay? No theme identification. So I get a complaint, I resolve it, I don't look at the big picture. We should, one of the solutions is to consider is having quarterly thematic reviews, board-level dashboard reporting, and cross-functional governance discussions about what's happening if we have an escalated complaint or consistently the same issues are arising. The fourth gap is poor documentation. Files that cannot withstand audit or tribunal scrutiny is really an issue organisations should be looking at. So some suggested solutions for that are clear issues lists, evidence logs, what you looked at, when you looked at, who looked at them, people you've interviewed, actions you've taken. Your documentation should always have rationale behind decisions and closure summary. So the actions you've taken and when you'll review it. The fifth gap is weak escalation pathways. So staff unsure when and how to escalate a complaint. From when I started in aged care a number of years ago to where we are now is significantly different. Previously, staff were quite afraid to raise concerns or escalate concerns in case they got into trouble. We now have a more mature, robust system when staff are also now advocates for consumers and residents, and they actually raise those issues. But are your staff clearly aware how to escalate? So some suggested solutions for that are risk severity scoring tools. Maybe your on-floor staff don't need to know this, but your management team should. Clear harm thresholds, escalation triggers. So that will be, at what point do I raise it with my manager, my charge nurse, my residential care service manager, my governance committee? And visible escalation flow charts should be clearly established for staff and even consumers, I would argue. So the data actually must tell us a story, and effective reporting includes quantitative measures such as volume by service type, themes and categories, harm severity, time to acknowledge, time to resolve. People get stuck, organisations get stuck. How quickly do we resolve a complaint? Well, it depends on the number of issues and the complexity. And sometimes the number of issues, you may only have one issue, but that one issue involves four family members who don't speak to each other and don't like each other, may argue the point. So that will increase the resolution time. Escalation rates, how many complaints are escalated internally or externally, how many repeat complainants we have, and that's a whole separate topic, and consumer satisfaction with complaints handling. So when we close a complaint, do you go back to that complainant in a month, in the 2 months, and say, you raised this concern, how did you find the process? And that provides us really important feedback about, is it working? Do you trust it? The complaints process, the quality of insights, root cause themes, emerging risk signals, workforce capability gaps that we may have, and cultural indicators. Now, we have a wide array of cultures within aged care services, our staff members. Some cultures don't want to manage complaints. That is fine. No issue with that. As long as they can escalate it and they don't fear escalating their complaints. So teaching or educating them how to do that. The next one is governance integration. The board dashboards with narrative analysis explaining to the board exactly what's going on and what the issues are. Linkages from our risk register to our complaints. Evidence of completed improvement actions. So you've completed a continuous improvement. Where is that documented? Is it easily accessible? What is the evidence? How can auditors have access to that? Is it easy to understand when they ask for that document and they sit by themselves and read it to understand it? Trend comparisons over time. So Mirus, of course, is an issue that is constantly raised throughout the whole of Australia. It's not unique. So are the trends decreasing about satisfaction? But if data is collected but not analysed and reviewed, regulators may assume it's not being used. Okay, so data is really, if you're going to collect data, what are you going to do with that data? How are you going to use it? So just to close off, complaint systems are a window into our quality of service and care, our culture as an organisation, our risk management maturity, and our governance effectiveness. And moving beyond compliance requires clear expectations for our staff and as an organisation. What do we do with complaints? Transparent communication and open disclosure is part of that, of course. Defensible processes. So basically that means being able to defend yourself when you reach a conclusion. Strong documentation, board visibility and continuous improvement. The goal is not to eliminate complaints. Complaints, as I said at the start, is a source of feedback which is absolutely critical to us as an organisation. The goal is to demonstrate that consumers, families, staff are being heard, that their complaint is being assessed fairly, that they're being responded to proportionately, that the information leads to safer systems. That is what regulators expect, and that is what actually builds trust for us as organisations. Thank you, Ben.
Fantastic. Thank you, Steve. You gave a few little gems and nuggets there for all the vendors and providers, should I say, that are watching today, and obviously they can take away. And so in your time, obviously, and you've obviously been doing this for a while now, would you say that the processes, people are better at this? Do you think there's been a dramatic shift over your time in the improvements of how homes manage these processes?
Yeah, look, from when I started to where we are today, providers have matured. There are more systems and abilities to manage complaints. But what's also significantly changed, what I've noticing is significantly changed, is that complainants are more informed about their rights. Complainants are more informed about the programs and processes to escalate complaints. But the negative out of all that, I've also come across that a lot of complainants, a significant number of complainants, we should say, are more aggressive in their nature and can cause more distress. And there's more family dynamics. And that's the intricate part that we need real strong strategies to manage and code of conducts and so forth.
Mm-hmm. And I think that's part of what we'll touch on as well with our other panelists today is that those consumer expectations nowadays and what people are expecting from the aged care home and the staff and the services that are provided, I think in society generally has probably changed drastically as well of what those expectations are and how quickly they will get that response and answer that they expect, as you've sort of highlighted in that communication time frame as well of what those expectations are and demands of society today.
Yeah, absolutely. Couldn't agree more.
Now, Steve, you are also a published author. So I just want to highlight to everyone, Steve has a book, Mastering Complaints Handling Best Practices for Delivering Excellence. Your New York Times bestseller, can I say that? Go with that anyway.
I don't think you can say that on a Times bestseller.
Fantastic. Now, there is a QR code on screen for those people. If you are interested in getting Steve's book, it's available on Amazon too. If the QR code doesn't work for you, you can do a search and find Steve's book that he's published, which will also give you some great insights on the complaint handling process as well. So please have a look at his book. Now, we're going to quickly do a quick live poll before we throw across to Nicola and Jess. So what we're looking at here, we're going to ask questions. So you should get something that will pop up on your screen in a minute. Hopefully this always works. So sometimes some technical difficulties. So what is your home's current status regarding whistleblower protections? So we have policies in place and staff are trained on how to report concerns. We have policies but haven't yet trained staff on the processes. We're currently developing our whistleblower policy and procedures. We're unsure what our obligations under the new legislation are. Or we're relying on broader organisational whistleblower framework that may be already part of, if you're part of a larger organisation already in place, or we haven't yet addressed our whistleblower requirements as well. So again, very, very similar on the theme here. So some of that information is coming through. So I'll give everyone a little bit of time to get their responses coming through. A few more coming through, so get those in and then I will close that off shortly. But we're trending in the right direction. We have policies in place. We're sitting at 43%, so we're trending in the right direction that people have those in relation to the new act and legislation. All right, I will close this down and share these results with everyone. So hopefully they will come up on your screen now. So it's actually not too bad. So we have policies in place and staff are trained on how to report concerns, 44%. We have policies but haven't yet trained staff on the processes, 35%. So there's still some obviously updating their teams on what they need to be aware of with the whistleblower protections. We're currently developing our whistleblower policy and procedures at 18%. We're relying on our broader organisational whistleblower framework for those that are part of a larger organisation at 4%. And good news, 0%. We haven't addressed our whistleblower requirements. So everyone is onto it. Everyone is aware, which is fantastic. And we'll now pass across to to our panel. So Nicola, I'm going to throw across to you first. Nicola is the Executive Manager, Quality and Organisational Development at Peninsula Villages in New South Wales. And then we'll come to you, Jess, the Quality and Compliance Manager at Benet Aged Care based in South Australia. So Nicola, I'll throw across to you. How are you managing these processes? And I'm sure as Steve was going through his presentation, there were probably a lot of those things in your mind were ticking off going, yes, we've got that, we've got that, we've got that.
Absolutely. It was a checklist. And thank you, Steve. It was really, really informative. And it was actually quite validating as well. I've been working a lot around our feedback process. And I guess, firstly, it's really probably separating feedback from complaints because we want to capture all of our feedback that we receive. And whistleblowers, I have to say that we have done a lot of work on that as well. And I feel like we're well aligned with the Act on that section at the moment. I think, firstly, what we're trying to do and is really underpin a culture where we have restorative practice built in from the very first interactions we have at pre-admission. and having a really open door policy for encouraging feedback, not just accepting it. We want to make sure that families have an understanding of the services that we provide, and we understand their expectations. We've done quite a lot over the last year about really building in opportunities for feedback from at the admission stage. So at day 7 and day 28, we have what we call partnering care reviews, where we sit down with the family and talk about how our resident is going. And obviously, if the resident's able, they're involved in that as well, as per what their wishes are. And then we have those conferences every 3 to 6 months, depending on the resident and their family requirements. For us, I think having that communication process is really transparent has really helped with us with not avoiding feedback, but being able to capture feedback at the time that we receive it. We put all feedback we use ManAd Plus, and we use the feedback section in that to capture our feedback. That gives us a lot more trend analysis. I think you've got to be careful that you just don't capture complaints, that you're capturing from all different sources so that you can really see what's going on in your organisation. My clinical governance manager does a really detailed report on we do a monthly report for our board on our complaints trending, and then we do a really detailed report every 3 months. That gives us a really good insight. To be honest, I don't see that many trends probably for us as an organisation that there's a clear trend in people saying that say personal care needs, we need to look at that from a system point of view. But there are certainly things that we pick up in complaints that we've been able to then put into our quality improvement program and really look at our system. And I think Tyler and Ben, you talked about, and Steve, you touched on it as well. Communication is the most important part of any care and service process. When people don't have the information, they go to their answers in their head, and they don't know where they should go. And it's really important when you're meeting with a family to really understand what their expectations are, but their perspective as well. So we might think that we're doing everything that meets their needs and I'm a registered nurse, from a clinical perspective or a personal care perspective. However, where they're coming from might be quite different, and we have to take in the emotions that people have when they've admitted their family member to residential aged care, and grief is often a big part of that. There's the cultural aspect, and people feel if they were caring for somebody at home that they could provide a certain level of care, and that expectation is different when they move into care. We have to really think about how we do that. So I think overall, that's probably where I come from around managing complaints. I'm really particular around wanting letters to be sent out with advocacy information. Generally, our facility managers or our service managers will respond to complaints. However, I'm on the letter if they can't resolve it. I have to say, no one's ever contacted me, so I'm really glad that our managers are very, very well equipped to manage our feedback. But we put OPAN details on there if they need assistance from a cultural or a linguistic point of view. We really want to make sure our system is accessible. We're not perfect, but I'm hoping that we're certainly making some really good inroads to make it a really collaborative and a co-partnership approach to complaints.
And Nicola, on the expectations of family members, obviously for people that have obviously been in aged care for a while now and done different roles and so on, have you noticed a change in expectations from families? A bit like Steve touched on the expectations around timeframes of getting back to people and so on. Have you noticed anything significant?
Yeah, look, I think that expectations are increasing. We're living in a different world that we were even 10 years ago. If we look at social media and the keyboard warriors out there, people are very happy to fire off an angry email than they were in the past. But I think we need to recognise that often that behaviour comes from either from an emotional standpoint or a place of frustration. And if they're frustrated, we've let them down poorly if they feel that they have to resort to that. There is a generational shift in how we communicate, and I think that's really what you're saying, Ben, that there is a difference. And I'm a Gen X, and I'm happy to put my hand up and complain when I need to. And I think we're moving from the silent generation to the baby boomers, and to us now as Gen X, putting our families into aged care. And there is a different expectation, and we expect more for communication. And when we don't have it, we're going to put our hand up and say, you need to up your game here.
Yeah, definitely. And you touched on obviously how you're dealing with families and residents as they come in, and obviously further once they've settled in as well. How have you managed the transition, I guess, in the education for staff? Obviously, with a new act, new standards, whistleblower protections. There's a lot of new things coming in place. There's obviously all the legacy processes. How have you managed, I guess, communicating the expectations and obviously what Peninsula Villages requires of their staff?
I think we've done it probably from two point of views. We're very fortunate with our L&D program. We have a really robust L&D program. And as soon as statements of rights were released, we did really comprehensive education on that. Whistleblowing protections we've got as part of our mandatory training. We've done lots of toolbox talks. That's one aspect, though. You can talk to staff and you can give them the information, but it's building it into your culture and your expectations and the processes that you do. That's the other part of it, and that's where you really get that true embedding of I suppose what really is a bit of a theory into how you do it. That is, as you would know, a much, much longer process, and it's a lot harder, but it's at staff meetings. And then you mentioned, Steve, about talking to every frontline staff member about how you do things. I think the power, as you said, around actually showing those case studies and how you work through a process and how it's done actually brings it home. And often it's not appropriate for somebody who is in a catering assistant position perhaps to be involved in a complaint, but bringing them into the process and explaining how it works, or getting their feedback and how we were going to then take their feedback and interact with families. I think there's a lot of power in there, and that's when you actually really start to see that shift in culture.
Yep, fantastic. Well, thank you for sharing that. I will throw across now to you, Jess. So you're obviously based with Ben Aged Care in South Australia. What are your initial observations? How have you been managing the feedback and the transparency processes?
Thanks, Ben. And look, a great session today. Really informative, and look, we're definitely tracking well. So Bene Aged Care is a called specific. We're an Italian provider here in South Australia. So we've got residential homes and home care as well. So we did have established systems and processes in place, but they really did need strengthening and review to make sure they were rights-based and person-centred. So our focus has been on that person-centredness, looking at TAHIC, the trauma awareness and healing informed care, and really trying to ensure that for our cohort of older people, that they could understand the information that was being provided, given that a lot Italian speaking. So translating our documents, easy read information about complaints into Italian, and really helping them that way. So we did have really good systems and processes, but we have gone through with a fine tooth comb in relation to those, and just made sure that we really have maximised the information available to our people and to our representatives. And so the next stage for us is really just embedding that and ensuring that shared understanding between staff. I guess the complexity we face is that complaints can be really, really tricky. And I say that having worked in industry. I'm also a registered nurse, but I've also worked in the Aged Care Quality and Safety Commission as well on those complex cases. And so I guess for me, the key is, it's about really being realistic about, what we can actually do, and really making sure that if we promise something, that it's is sustainable. So that's that proportionate, risk-based and sustainable, and making sure there's no impact on others as well. I think that's really critical. So Yeah, I agree with what Steve said. I think that complaints are so powerful. We learn so much. We can do continuous improvement through them, and it's just an opportunity for us to be able to look organisationally at what we're doing and to improve that.
And with obviously being Italian specific, I don't want to generalize, they can be a bit fiery sometimes. I'm sure you've dealt with a few family members. Just in how does that work in your space now as well, dealing and the different communication methods obviously that are available. Are they face-to-face people? Are they phone calls? What's the typical sort of processes that you run internally when you're managing and reaching out to people about those complaints as they raise them?
Yeah, so we do it on a case-by-case basis, and we have multiple options available as far as like language and understanding. So a lot of our staff are Italian speaking, and when we do hiring, we do really try and attract people who have got Italian speaking where possible. It's not always possible, but we've also done a lot of translation, and we offer translators as well. So, but a lot of our policies, procedures, etc., we have translated. So. And we've received really positive feedback about that. And then we've also expanded the way we communicate, so enhanced, updates in newsletters and, other mechanisms to really try and just make sure that shared understanding is there. We've updated the policies and procedures. It was quite good to see. That we're well on track. But again, though, it is just that embedding and making sure that staff feel supported on that journey because, complaints, they can be really tricky. Sometimes it is only one or two issues, but, trying to resolve those depending on what they are, it's not always clear cut.
Yeah, and similar question to that I raised to Nicola. How did you manage, I guess, all of the education components of with just so much new information around the standards, the Act, and obviously then whistleblower protections, obviously refining those processes. What sort of takeaways could you give to people that worked well for yourselves and just making sure that your workforce were up to date with your current policies and procedures and how they were meant to handle some of these topics?
Yeah, we've had really robust discussions about that as an organisation, and I think that we really have to think about lots of different factors. So the age of our staff, the cohort of our staff, the different skills and experience levels, and then also not trying to overwhelm people with having to do AusMed course after AusMed course. So we've done a combination of toolboxes, the micro learning. We're presenting, so I often go to the staff meetings, just do short sessions that inspire people but don't bore them. So we have an open door policy, and they come and find out more information as they need it. As I've been updating policies and procedures, always adding the links in so that people can seek that additional information if they want to learn more about it. And also circulating organisationally all those great webinars and the commission resources that are coming out. So, and encouraging our facility managers to share that with their teams.
Yeah, no, definitely. Like the department and the commission definitely put out some great content, and sometimes it's almost too much content. So you've got to sort of get it and disseminate it to everyone because there's always new things, new documents, and new fact sheets coming out, which are great resources to share. And just lastly, just with you as well, have you noticed in your time, obviously, is the expectations and the demands from families and from residents getting higher as well in your space?
Yeah, absolutely. And it correlates as well with the acuity. So the acuity in residential has risen significantly. So, at the start of my career, people were living in residential care for 6-7 years. And as we know now, it's under 2 years. So, they're coming in at a lot higher care needs. And it's about really trying to establish what those preferences, care goals and needs are right at the beginning of that care journey. And Steve spoke about expectations, and it is about expectations. I think it's also about asking those questions to really try and understand from them. And what they're seeking and what they're wanting, and setting those expectations really clearly at the beginning. So yeah, it's really interesting with all these new concepts as well in aged care, and pets, sexuality, things that we haven't really done a lot historically. And I think, these things, they're fantastic for person-centered care, but they also bring about new challenges that, perhaps we haven't seen a lot of in the past, because we have typically had quite a clinical model in time gone by. So, yeah.
Yeah, definitely no more challenges, pets and some of those things as well, because I think of the expectations going forward. Everyone will be able to bring their dog or cat into the home and that make it part of their home. Yeah, more challenges, but I'm sure that there'll be tools and definitely some policies and procedures everyone can refer to and look at to sort of start to implement into their organisations. So we're going to throw across to the chat now. Do we have Chris with us, or is that Tyler working the questions? Are there any questions specifically for our panelists, for Steve, Nicola, or Jess?
The chat actually is unusually quiet
Wow.
for this round. And I think one of the things I still am not entirely sure about is the way the commission has sort of split complaints into two different categories, whether it's a lack of consultation or a complaint of communication to the family. I wasn't able to sort of understand how that was differentiated, other than potentially there was some agenda that they wanted to have medication management be number one. So they took the number one complaint and split it into two apparently different categories. But looks like we do have a couple of questions coming in now. Allison Moss says, I would like to know how residents with behaviors of making serial complaints are managed. Example being food. So that's a pretty good question as well, where I guess I think anyone that's been in aged care long enough has encountered the serial complainer. And yeah, what strategies do you think work there? And I'll open that one up to the panel where, yeah, obviously, particularly in that age group, no offense, but you can encounter people that are not going to be satisfied with any resolution. And how do you manage that?
Steve, do you want to take that one? How I'm sure you've dealt with that a lot over your time. Meals and nutrition, hydration, and serial complainers.
Yeah, look, it's more about sitting down. Now, I'm just reading that residents with behaviour. So we're talking about cognitive impairment, or we're talking just behavioural issues as a serial complainant. If someone has a cognitive impairment and they're constantly complaining about food, well, that's one of the last things that goes in one's memory is the taste and quality of food. So it's about making sure you sit down with them about what are their likes, what are their dislikes, explaining that they have a choice. You may have discussed what they may have picked their food preference the day before about what meal they want. You will have to remind them what they've chosen and whether they've changed their mind again. And getting specific, what is it about the meals that you don't like? Be very, very specific. Ask those questions, and then don't fill in. I keep on saying to people, don't fill in when you ask a question. Don't fill the gap of silence. Allow the other participant to answer you, and if they don't answer you, well, that's the end of the conversation. But asking the consumer, what is it specifically about the meals that you don't like? Is it the flavour? Is it the type of meals that are being served? Do you have a particular preference? And documenting that and having that ready to use in case it escalates somewhere else. But it's about consultation and asking the question, what specifically are you referring to about the meals?
And Nicola, Jess, do you have anything else to add? I know those Italians are probably fussy about their food and what they get.
Yeah, look, I concur with Steve, but I think as well, for some residents, sometimes, when you make a complaint, it means that someone's going to come and talk to you. It could be, social isolation. It could be that person is anxious. So it really is about that holistic assessment. it is. It's about that, and finding out as we go through the complaints process, if there's anything else we can do other than the food to try and enhance that person's quality of life. And of course, the key for this is really, really strong clinical documentation. And if we've committed ourselves to a particular type of food, sandwiches with something, without crusts or whatever it is, that we're actually following through, and that we're checking that that's being followed through. So,
yeah, fantastic. Nicola, do you have anything else you'd like to add to that topic?
I think we've had that in one situation with a resident that we just weren't able to find anything that we could serve them that they were happy with. And we did all of the consultation pieces that you spoke about, Steve, and Jess, all of the documentation as well. In the end, not everybody eats the sort of meals, and I think that some people would live on fast food and do things that are probably a little bit out of the ordinary. So in the end, we agreed that they could just order anything they wanted from the kiosk, and that worked for them. We found a bit of a mutual situation. They chose what they had then, and sometimes it's just about trying to find a compromise. But it's some people, and one of the questions about people who are aggressive or difficult, you can't always find a solution for some situations.
Yep, definitely. Tyler, is there anything else before we wrap up today's session?
Well, yeah, we had quite a flurry of questions come in, a little too late, because we are sort of right on time now.
I can answer one of those.
Go for it, Steve.
In regard to the time frame for acknowledging and resolving, acknowledgement should be between 24, 48 hours, business hours. And resolving, that's a little bit more difficult depending on the number of issues, but normally you look at 28 days for resolution. But keeping in mind that you may have to interview staff who are away or on leave or holidays, you may not be able to communicate with the family because they're not present and the person lodging the complaint. But acknowledgement is 24 to 48 hours. And then as soon as possible to resolve it, for 28 days normally, depending on it. And then can you ask aggressive family members to leave the building? Very, very good question. If there are health and safety risk or psychosocial risk, I would definitely be asking someone to leave. However, you should also have a code of conduct for families. So you're always welcome 24/7 to enter our building. However, this is the behaviour we expect of you once you're on our premises. That should be provided to every resident and family upon entry. You should be on the walls in a nice format. But yet the answer to that question is aggressive family, depending on what your definition of aggressive is. Yes, you should be asking someone to leave if they're going to cause, if they're a hazard to your staff and to other residents.
Fantastic. Awesome. Well, we will start to wrap it up. If there are other questions, the contact details, obviously, for all of our panelists will be available. So if you want to reach out to any of them. Also, we do have accommodation pricing report available. So again, there is a QR code, and also you can find that on our website. There is a free offer that has been extended to the 31st of March. So if you are interested in a tailored report on your pricing, you can get that available. We also have key minutes performance report, so that can also be found on our website and via our QR code. And as always, this recording slides will be available, so if you can't grab the QR code or the website, and also for Steve's slides, if people are really interested, they will be available, obviously, in our recording of this. And then our next webinar. So we're going to revisit health. So we touched on this briefly late last year, but now we're sort of entering sort of 4 or 5 months of being implemented from 1 November and getting closer to people that were on those additional services, extra services. We are going to be running a webinar on the 26th of March, which you can register for now, looking at health as a competitive advantage. And obviously those pros and cons, and talk to some providers around their health offerings and who's decided to go down different models with their higher everyday living fees. Thank you from us, and thank you from all the panelists, from myself, from Tyler. Wish you all well, have a great afternoon, and thank you so much for joining us today.